So ALK positive cancer, it's typically lung cancer, and it is a type of non-small cell lung cancer that is caused by a mutation in the ALK gene. And what happens is that it ends up fusing with another gene and producing a mutant protein. And that protein, which should be turned off in healthy adults, is turned on and triggered to reproduce, which causes the cancer growth. And ALK positive lung cancer is very different from what you think of as typical lung cancers because it's not linked to any environmental factors or any family history. It's pretty random. It only accounts for 5% of all lung cancers. The majority of the patient population are never smokers, no known risk factors, and they tend to be younger than an average lung cancer patient. So the disease also presents very differently. It oftentimes, by the time it is diagnosed, a patient is stage 4, meaning that it's metastasized. And what's the first symptoms then are based on the metastasis rather than the lung. So they may not have any lung symptoms initially. So my brother was diagnosed with ALK positive cancer in early 2023. He'd probably had it for a while before then. As with most ALK positive lung cancer patients, he was not diagnosed until he was stage 4, meaning that it was metastasized. Genetic testing is very important, and there's no way to know that you have ALK positive unless you do the genetic testing. So most of the money that is donated to ALK positive goes directly into clinical trials and research. They partner with universities that are doing the initial research. They partner with other foundations. They partner with wherever the most promising solutions are. The ALK positive organization was founded by an ALK positive patient, and it's completely led by ALK positive patients and some of their care partners. And it's really what the organization themselves, what the patients want. And number one is the research, because this directly impacts their life. This is their chance for survival. I think the ultimate goal of the organization is to find a cure. And along the way, while they're finding that cure, is to support, very directly support the quality of life and extend the quantity of life for the patients that currently have ALK positive lung cancer. And I love the fact that most of the efforts are run by volunteers. So it's very, it's a great use of dollars because the money goes directly to research and to some of these programs like the Second Opinion program, whereas a lot of the day-to-day care and community is not using up funding because it's run by volunteers. And it is also providing exactly what the patients need, because the patients are deciding what they need. They're even deciding on what they want to fund in the way of research. They are really good stewards of the money. So they just check all the boxes.